After decades of skyrocketing prescription prices, the White House says it is now taking some serious action. President Donald Trump signing an executive order directing the government to negotiate with drug makers, and if talks fail, cap prices to match what patients pay in other wealthy countries. It is called the most favored nation policy. NewsNation's Elizabeth Pran is following this story for us. And Elizabeth, some critics say this is a form of price control.
Well, Anna, there is a lot of pushback, right? I mean, this story could impact millions of Americans. So basically, big pharma and then pharmacy benefit managers. So the middlemen, the people who negotiate between the pharmaceutical industry and insurance companies, they are pushing back. The ink's not even dry yet. Look at this statement from the Pharmaceutical Research and Manufacturers of America. They write in part, it's a bad deal for American patients and workers. It'll make the U.S. more reliant on China for innovative medicines. We're also hearing that from biotech advocates who say the shift to the most favored nation pricing, you mentioned that, which basically says that our numbers would match those of other countries, would be devastating to medical innovation firms. The president has at least one unlikely ally in Vermont Senator Bernie Sanders, who has called on the president to support legislation that he also wants to introduce to keep American prices in line with the international community. So Health and Human Services Secretary Robert Kennedy Jr. is leading those negotiations now to bring those prices down. So you might be wondering why? How egregious is the price gap? Well, let's take a couple medications. For example, Wegovy. This is a very popular GLP-1. It's about $1,300 here in the United States. And in countries in the UK, it's $92. Ozempic is right around $1,000 here in the US. Look at France and Germany, $71, $59 respectively. So the White House basically says that this could slash prices between 30 and 80%. We know the Biden administration did negotiate Medicare prices during his administration, but those aren't going to take place for another year. Americans are simply wanting lower prices right now. Anna.
Yeah, especially when folks take multiple medications every day. They have multiple family members. Everything really adds up. This could make a huge difference. This plan is likely to face some legal challenges, though, too. Can you outline those?
There's going to be a lot of legal challenges, right? Companies are going to push back. There's going to be lawsuits. And in fact, we do know that some of the nuances do require congressional approval. So it's not going to be a one-stop shop. It's not going to be a simple shift. As you remember, President Trump did try to make a similar law or similar order back in 2020. And of course, that was struck down by the court system. So it is a bumpy road, but we do have a new push, really, from millions of Americans who simply say drug prices are just too high. Anna?
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.